All right, welcome to Deuk Spine Institute. I'm Dr. Deuk Majan, CEO and founder. We are on our last surgery for today. And our patient has, honestly, a lot going on. I'm not going to lie to you. She has many sources of back pain. I had a talk with her yesterday when she came here. And I said, listen, on examination I found, 2 discs causing pain, facets, SI, piriformis. You got a lot. And one surgery isn't going to fix everything. And I honestly feel horrible for her, having so many problems. Now, I get these calls quite often from our viewers saying, hey, can you do surgery on a patient with, connective tissue disorder? You okay? You okay?
I took her a little deeper because she's having problems on her stomach.
Yeah. Oh, that's perfect. Look at that facet, though. That's where her pain, she's got bad facet disease. Look at that facet. Show us the facet. This is for her to see. Look at the facet right there. Yeah, that's right. It's like wavy gravy. No. Go to the middle. Keep going. Go. No, to the right. See that right there? That's the facet. You see it? Kind of looping there, Jordan? Yes, that's it. There, no, that's where it ends, right there. And now go to the left, out to the foramen. Keep going. Down, right there. That is her facet. Totally abnormal. And she has Ehlers-Danlos syndrome. And you can see it's people do get abnormal facets without Ehlers-Danlos, but that thing is really abnormal. I guess trauma makes things a lot worse. She's got a bad on the other side too, but not as bad. Okie doke, so let's get going. We are getting ready to enter L4-5 shot on the left side, then we're going to go over to the right side. Shot. Perfect. Yeah, so 1 down, 2 more to go. Shot. Num. I almost feel like we can do a little better than that. Let me see. Let's give her some more medicine. That's good. So basically, long story short, she's got a lot of reasons to have pain. And we're hopefully going to get rid of a couple of them today. Shot? Perfect. AP. Get this out of the way. Everybody agree we're doing right 3-4, bilateral 4-5. Is that correct? All right. We're almost ready for her to be awake. Quickly. Don't put your hands in my path, all right? You're going to have a really bad thing happen one of these days. You understand? I don't want anything to happen to you, but that's up to you. Shot. All right, so 3-4 looks good. Shot. Yeah. 4-5. Shot. 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 When I say shot, by the way, folks, what I'm really asking for is a picture. I'm asking Jordan Shot to take a picture with the x-ray machine. Not of my hand, but Shot. So this is a little high. Shot.
Surgeons say touch.
Patel?
Davis says
Oh,
touch.
Davis says touch.
Yes.
I think that's just ridiculous. Shot? I mean, honestly, who would say that? Touch? Like, what are you supposed to be touching? Sounds like Jeff Epstein or something. Shot? Oh, this thing is giving me a fit. Shot? 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 AP? All right, just about done. So step one is always get the needles in first. Needles create a safe path. All right, too far lateral. You see we have a very abnormal facet there. You see the bone that it's hitting? All right. Shot. Shot. Yeah, there's the facet. I gotta get around it. Shot. She awake?
Hello, how are you?
Shot.
Are you okay? You doing okay? Good morning.
Shot. She just very sensitive.
Yep.
Shot. Let's see where that is. AP. So I'm trying to navigate this L4-5 right side needle through her foramen. I'm getting around the facet. The facet is abnormal. It's enlarged. It's got some weird spicules pushing out. That looks good. So, but you can also see the spinous process is abnormal. Show them the abnormal spinous process at L4. You guys see how it's angled at as sideways, and the other ones are kind of straight. So that's the way she was born. She was kind of born with a little bit of abnormality there. And that's probably why the facet joints are affected as well. All right.
Hello, how are you? Can you open your eyes for me? You open your eyes? Feel a little sleepy?
So we're good. Our needles are both placed perfectly. We're ready to get started. So I'm just going to show you guys a little pain map. When she came to see me, I asked her where her pain was. I'll show you all the places. She has pain here. That's the piriformis. Can you see this, Henry?
Yes, we can.
She's got pain here. That's the SI joint on both sides. She's got a right and a left, and both of them are hurting her. And then she's got facet pain. And it's no surprise because you could see those abnormal facets on exam. Then she has disc pain as well. And that's your L3-4, L4-5. Plus she's got pinched nerves from herniations. All right, how is she doing?
Hello? Can you open your eyes for me? Hi,
Shot?
we're gonna ask you some questions, okay? All right, open your eyes.
You know, I think we can just, you know, I don't know that we're gonna get a good. She's clearly responding. Yeah, she's having pain there, but she's too sleepy, and I'm not gonna wake her all the way up. So let's just proceed. We'll start with the left side. Yep, shot. Now the left side we're doing L4-5. Move those cables out of the way, please. Shot. Good. Thank you. I need a knife. No, patient asleep. Yeah, it looks like she's sensitive to the medicine, right, Berndes? She's just narcotic naive, I guess, right? Look at her facets, how abnormal they are at 4, 5, and 5, 1. Jordan, show us.
You want to go deep again?
Hmm? You guys see that shot? Very abnormal. Yeah? Take your time. We're just going to wait a minute. You're doing great. Just lay still. We'll give you some more medicine. Well, she woke up with that. Is the IV working? Shot? Yeah, lay still. Shot? Let's get the light on there so that the anesthesiologist can see. All right, I'll put a little pressure. All right. Well, we're working on getting her back to sleep. We'll just be waiting. Any questions from the audience?
Yes, we have a question from Lupisa on Facebook
Uh-huh.
asking, why doesn't anyone else work with your method?
Great question, Rabisa. First of all, the method I use is very advanced. So it's kind of like asking, why doesn't a country just build a stealth bomber? They don't have the technology, they don't have the equipment, they don't have the knowledge, they don't have the experience. It's the most advanced surgery in the world, so you can't expect surgeons, everybody, to know how to do it. Just like not everybody can build an atomic bomb, or not everybody can build a stealth bomber or a fusion reactor. I mean, there's lots of technological advances that are not available everywhere in the world. They're only available in a few locations. This is one of those technological advances. Seems simple when you watch the surgery, but it's actually very complex, and it's not part of 99% of spine surgeons' training. They don't know how to do this. I had to learn after training. Second of all, the equipment is millions upon millions of dollars. To set up a facility like this, you're looking at least $20 million. So not every doctor can afford it or has the ability to borrow the money to do it. And then third of all, the money that surgeons make for fusions is so much, it's far more than we make for these surgeries, that they're financially incentivized just to do fusion. How are we doing over there, Doc?
I need 5 minutes.
Are we putting an IV in? All right. So that's why. There's financial reasons why doctors don't do it. They make more money doing more invasive surgery. There are technological reasons. They don't have the technology available. It's too expensive. And there's training. They're not trained to do it. So it takes time for procedures like this to spread around the world when there are new technology that's difficult to repeat. All right, Henry, why don't we run a video showing how do discs cause so much pain? All right, great. So now you see why a disc herniation is so painful. It's all the inflammation in the tear. This patient, we're putting her a little bit deeper. We're just kind of gently putting her to sleep. And we had turned off the medicine for a little bit so we could do a discogram. But she's, I guess, very sensitive. So we're just waiting and letting the anesthesia do its job. What questions do we have?
This next question comes from Betty on YouTube. Betty asks, can you tell me the difference between a facet joint pain and a disc, if any?
Yes. Betty, facet joints cause pain in the back. Discs, injuries can cause pain in the back. They both cause back pain. You cannot distinguish between them, but I can. It has to do with location, exacerbating movements, and probability. So there's just a variety of factors that sort of allow me to figure out if a patient has facet pain, disc pain, or both. I could tell you the most common cause of back pain, 90% of patients with back pain have disc pain. They have a disc that's hurting, or two. The average is 2.2 to be exact. So if you know anybody with back pain, they have a 90% chance that their back pain's coming from 2 or more discs. Facet pain is quite common though. It's the second most common cause of back pain and found in 45% of patients with chronic back pain. How are we doing, Doc? Can we get her arms situated on the arm board so her chest is flat? Are they good? Yeah. All right. All right. So our patient is asleep. I'm just going to go gentle and slow. Shot. Hopefully she hasn't moved anything out. Huh? No, I'm just talking to the audience. I said I'm just going to go slow, gentle and slow, at least up to this part. Can't really be too gentle with a hammer. This is responding a little bit. You want me to wait a little more, or you want me to proceed? What do you want me to do? Uh-huh. It's just very minor. Huh? The local? We didn't use too much. Take that. Wait. Shot. Yeah. I understand. Take that. Yes. Looking good. That's fine. I'm fine with her now. If you're okay with her. Shot. Yeah. Look at that. The pressure of inflammation inside the disc has shoved the dilator out. Wow. There's a lot of pressure in there. Amazing, huh? Yeah. I'm hitting the dilator in and it's literally pushing it back out. Look at that. Yeah. It's almost like a 22 caliber. Shot? This disc is under massive pressure. Maybe this is part of the collagen vascular disorder. So, as I hammer the dilator back into the disc, shot, it's literally getting pushed back out by her body, by the inflammation and pressure going on inside the disc. Shot, so we just got to be really careful here. Shot, that looks good. I think we're okay now. Shot, yep, we're good. Lot of inflammation. That's why she's having so much pain. Just like you guys saw on the video. Inflammation is the source of pain. All right, let's show the video on how we actually repair the disc with the laser. Okay, welcome back. Hopefully you now understand how the laser works. Basically, we're in here using the laser to break up the herniation into small pieces, and those little pieces fill up the water column, and then we float them out. You can't even see them, they're so tiny. But the laser basically vaporizes this abnormal tissue into small pieces. It shrinks it up, and those pieces float out. It's really hard to see because the movement is so quick, but if you could slow it down 1,000 times, you would see tiny little pieces of tissue floating out. That's what's happening. We're using the laser to bust up all this bad stuff, scar tissue, calcium, herniation, and then we're removing it through the tube. It's constantly being irrigated out. All right, I know we've got questions. I just want to say, I was talking earlier while you guys were watching that video about how we have a few patients that we see every once in a while that I go and put the tube in their disc, and their disc pushes it out, just like she did. Like pushes it out firmly, hardly, very hard. And I wonder if those patients also have like Ehlers-Danlos syndrome, you know? There's a couple of types of connective tissue disorders. They include Marfan's syndrome, which Abraham Lincoln is the one who made that famous, and then Ehlers-Danlos. And they really are genetic disorders where the patients who have these conditions are born with the genes expressing these connective tissue disorders. And whether it's Marfan's or Ehlers-Danlos, they're different genetic defects, okay? One of them is, I think, elastin. The other one is a collagen disorder. But in the end, collagen and elastin are part of our connective tissues. So these patients have problems with like joints and joint capsules, hypermobile joints. They also have some other things that happen in their bodies, which I don't know all of them. I'm not an expert. But I just think it's interesting that her disc was trying to push our metal tube out. Now you don't see that often. This is all herniation here, the blue stuff. So, all right, questions for me?
This next question comes from Lubisa on Facebook once more.
See the red there? That's inflammation, what we were talking about earlier on the video. Yes, Lubisa, on Facebook.
They ask, can you use your method to operate on a degenerative disc for which doctors would normally recommend fusion?
Yes, Lubisa, that's exactly what we're doing with our method. Great question. So Lubisa asks, can we use this for degenerated discs that doctors would normally recommend a fusion? The answer is yes. This surgery replaces fusion completely. If you have this surgery done, you don't need a fusion done. We've never had to take a patient that had this surgery and do a fusion. And almost every single patient that has this surgery was recommended for a fusion as well. So we are taking fusion patients and preventing them from getting a fusion, and they're getting this surgery done instead. And we've never had to turn one of these patients into a fusion, because the surgery works better than a fusion. So what I'm doing is I'm doing the surgery. I'm looking for things that I can say, yeah, that's different, right? Because I know she's got Ehlers-Danlos. I know that Ehlers-Danlos affects these connective tissues right here that I'm operating on, the annulus, fibrosis, probably the nucleus pulposus as well. And I'm looking for any evidence that I can see that says, yeah, this is different than what I normally see. And right now, I'm not seeing a whole lot of difference. Like, I can't visually see it. Now that said, these connective tissues, elastin and collagen, that are affected by these connective tissue diseases like Marfan's and Ehlers-Danlos, they're microscopic. You can't see the individual fibers. But I'm looking for gross changes, like things that we can actually see with our eye. And I'm just not seeing anything. In other words, if you didn't tell me she had Ehlers-Danlos syndrome, I could never tell. I mean, honestly, it looks like just another disc problem that I fix in thousands and thousands of discs that I've done this for. It doesn't look that much different to me. It doesn't really look different. I can't say there's something here that, oh yeah, that's an Ehlers-Danlos disc. Honestly, it looks a lot like thousands of other discs we treat, right, Luis? I mean, can you see anything? Am I missing something here? The color's the same. The structure looks the same. The disc is pretty scarred up here, but you know, we've seen a lot of that. I think we're just about done. I have about 30 seconds left here on the left side. Then we're going to go over to the other side. Sometimes you can see the needle from the other side. All right, well, you can see where the blue stuff was, right? That was the herniation stuck within the tear. So far she's doing great. She's sleeping nicely right now. Comfortable, right, Doc? All right. Pretty much done. There's the nerve, you guys. See the nerve right there? People ask me, how do you not hurt the nerve? Okay, this is how we don't hurt the nerve. We have a metal tube, and the nerve is on the outside, the laser's on the inside. So the nerve is protected. But you see how red the nerve is, folks? I want to show it to you again. I'll show it to you in just a second. I'm almost done here. I just want to clean this up a little better. All right, let's go back and look at the nerve. You see how red the nerve is? It's supposed to be completely white. You see how it's pink? That's inflammation. Where does that inflammation come from? Right there, the tear. Now, look at this tear. I've cleaned out the herniation. Look how wide it is. It's 2 millimeters wide. The glass fiber is 1 millimeter. So you got one there, 2 millimeters. So we've basically taken the big tear that's about 5 or 6 millimeters and we made it 2 millimeters. So we've already started closing it off. That's fat up there. Look at all the red and pink. That's all from inflammation. Basically, she's got a lot of inflammation here. And now it's going to go away and she's going to go back to normal. It's wonderful. This is all people need, folks. They don't need fusion. We used to do fusion on all these. And it works if you do it right, which most surgeons don't do it right, but it's unnecessary. Put somebody through a big fusion. I think she's going to be really happy with her results. Any questions? We got to go to the right side and do 2 more.
Yes, we have 2 questions. This next one comes from Lubisa, once more on Facebook. asking, how do you solve when the patient also has displacement of the spine or spondylolisthesis?
Oh, yeah. Lubisa, we don't need to treat spondylolisthesis. If you've been told spondylolisthesis needs treatment, you've been lied to. It doesn't. Okay? Now, the doctor that's lying to you or the people that are lying to you probably don't know they're lying to you. But you don't need to treat spondylolisthesis unless it's a grade 3 or grade 4. 99% of spondylolisthesis is grade 1 or grade 2. In my entire career of 26 years, I've only seen, I think, 2 cases of grade 3. And I've never seen a grade 4. And all I do every day is spine. So there's lots of spine surgeons like me, all we do is spine. But grade 4 spondylolisthesis, called spondyloptosis, I've never seen it. Grade 3, I've seen 2 cases. So 99.9% of people are grade 1 or grade 2, and you don't need anything done about the slippage. Leave it alone. All right. Someday, soon, there will be no doctors in the world treating spondylolisthesis. There's already arguments about it among surgeons now. Half the surgeons say it needs to be fused, the other half say no. I'm in the no, it doesn't need to be fused half. She okay?
Yep.
Let's see. She may be, let me just see how she's doing here. Hold on. Shot. Coming down on the disc. This is the painful area. Seems to be okay. Come on. So great question, Labisa. You don't need to treat spondylolisthesis. Leave it alone. The problem is patients see that and then they think they need it treated because their doctor tells them that. But the doctor is not telling you the truth. Take it. What you should be asking is, why would the doctor not tell me the truth? Why would the doctor tell me to have a fusion done? And the answer is going to be very disturbing. Basically, money. Money for them, money for the hospital, money for the implant companies. That's why they tell you to have fusion. Not good for you to have the fusion, it's good for them. Will you get better with the fusion if it's done well? Yes, you will. But it's completely unnecessary.
We have another question.
Sure.
This comes from Roscoe on YouTube.
Yes, Roscoe.
They ask,
I
why
need
is
the IV bag moved or the pole moved. All right, never mind. She's going to move the monitor. Careful now. Don't break it. No, there's nothing to grab out. It's all... Hello, Roscoe.
They asked, why is it that the most spine surgeons tend to think that annular tears are not symptomatic when in fact they are debilitating?
Because, Roscoe, doctors have no clue. They literally only know what they're told by their teachers at the university. And this is new knowledge. Literally, only a few doctors in the world know this. It's cutting edge knowledge. I'm sharing cutting edge knowledge with the public before even doctors even know about it. You guys are all used to going to your doctor to get information. But what I've learned is that doctors are very unreliable. They're reliably unreliable to share new information, to share the truth. And the reason is that doctors, unfortunately, have ulterior motives for doing what they do. And a lot of times what doctors want to do is not what's best for the patient. So I'm a patient advocate, personally. I always do what's best for the patient. So for me, I realize I thought all doctors were the same way. They all want to do what's best for the patient, but they don't. They actually want to do what's best for themselves. And so that's true for probably 90% of doctors, not all of them. There are good doctors out there, but they're very hard to find. And the spine world, the world of back and neck pain, typically attracts the wrong types. the types that are highly motivated by money, greed, power, and what I've learned over the years is that they're immune to the truth. They don't want to know what the truth is. They just want to do what they feel is best for themselves. Oh my gosh, look at that. Henry, you got to get that, dude. That's inflammatory tissue. Let me see if I can stop the irrigation. Hold on. Folks, there it is. So, Roscoe, proof right there. Inflammation, red inflammation. That's where the pain comes from. Do you have that?
Yes, we do.
Henry, did you get it?
Yes, we do.
Beautiful. Let me see if I can clear it up a little bit. Oh, yeah, there's a little better picture right there. And there's the laser fiber right there. Can you get that one?
Yep.
Send it to Sanjay as well.
Copy.
Okay, how do I know the annulus hurts? Because I've debrided thousands now, and I've cured back pain in 99.6% of the back pain, and I haven't done a single fusion. You understand? None of these people have been fused. They've been cured without fusion by just cleaning up this little tear. So you tell me, if all I'm doing is cleaning the tear, why am I able to cure back pain from the disc? The answer is the tear is the source of the pain. That's the only thing we're doing different. We're debriding the tear. So we've already known this. We've published it. It's been peer-reviewed and published for now 12 years. If you look online in PubMed, you'll see our work. Why aren't other doctors doing it? Because you seem to think doctors do things because it's right for the patient. You're wrong. Doctors do things mostly because it's right for them. And this surgery is not right for them. They want the big bucks that come with fusions. Artificial discs. It's basically a racket, and you guys are the victims. Someday you'll understand my words to be true. Whether you believe me today or you don't, man, look at that. Oh, I love it. Henry, can you get that too?
Not a problem.
Just so pretty. Yeah, it's pretty. It's like a red rose. Take a picture. Inflammation, folks, right there. Get that to Sanjay and me. That's a beautiful picture. You got it?
Yes, we do.
Thanks. Irrefutable. It's 100% right there. We're not using any dyes or coloration. That red is inflammation. We know that as doctors. We know what inflammation looks like. Inflammation has been around for millions of years. I hate to say that, but it's true. And anything red and engorged like that with blood vessels, that's inflammation. Of course, it could be an aneurysm, but that's not an aneurysm. If that was in the brain, it might be, but it's not in the disc. Besides, it's already been established it's inflammation by other doctors besides me. All right, we are pretty much done at this level. That's going to really help her a lot. Very nice, very nice. I'm happy for her. She's going to get some really good relief here. This tear will heal itself now that we've cleaned it out with the laser. This is how you get rid of back pain, folks. Any more questions, Henry? Got one more disc to go.
Yes, this next question comes from Betty, once more on YouTube.
There's the nerve, by the way. Look at this nerve, folks, right here. See it?
Yes,
now,
we do.
Notice how it's a lot whiter, not as red, not so much inflammation. Okay? And notice how it's outside the tube, protected. That's the whole point of the surgery. We put a tube so we can protect the nerve while we're doing this. So I just want you to notice that there's fat right there, okay? But that's the nerve root. And it's beautiful. Not as red as the other side. Now look how small the tear is now that we've cleaned it out. She's not happy about this because I'm right near her nerve. All done. But you can see the nerve is intact. It's, we didn't do anything bad to hurt it. It's a little strong there. You see that? Yeah. I don't know who mixed it up, but. Any questions?
Yes, this next question comes from Betty, once more on YouTube.
Sure, Betty.
They asked, with a grade 1 slip disc, what can I not do? Can I ice skate, run, or swim in the ocean? Thank you.
Betty, if you have a grade 1 spondylolisthesis and you're perfectly symptom-free, no symptoms, no back pain, no leg pain, nothing. You can do whatever you want. Anything, no restrictions. I will tell you this though, I tell all my patients never deadlift, clean and jerk, squat, hack squat. Those are very bad exercises to do in a gym. They're really bad for your back. You can do everything else. You can do anything, military press, run, jog, yoga. I mean, you can live a normal life. Just don't deadlift, don't clean and jerk. You know, those are just stupid exercises. Now, if you're having pain, you need to come to Deuk Spine Institute and get fixed. Once you're fixed, you need to wait a year, and then you can do whatever you want afterwards. Your disc will be healed. You'll still have a spondylolisthesis. It will be no different. So, no symptoms, do nothing, and have a normal life. You may develop symptoms in the future, but if you do, it will not be from the slippage, it'll be from the tear. Then we can fix it at Deuk Spine with laser. On the other hand, if you're having symptoms, come get it fixed, because those symptoms are not going to go away on their own. This surgery will fix it though. Alrighty then, hold on, take that, good, yes, perfect. Last disc. I am so happy with how she's doing. I know the anesthesiologist thinks she's a 8 out of 10, 9 out of 10, 10 out of 10, 8 out of 10. Wow. But for me, from the surgery side, she's probably a 4 shot. I think that's good. Shot? Shot? Yeah. You would have won the gold with the surgery? That's funny. All right, last disc. She's going to go home in probably 30 minutes after we're done. What is it, 4:30 now? 4:30? Huh? Don't worry about it. I'll take care of it. All right.
4:32.
Yeah, I can't see either. I think that those are the writing. You know, you can always do. Huh? You can always do a scratch. Right? Huh? I mean, a little scratch on the outside of the tube, and then you know where's where. I'm just saying. You don't have to do that. All right. We are now at L3-4. Look at this disc. What a difference, huh? Compared to the last one. The last one was far more advanced with the scar tissue and the degeneration. This one looks like much younger herniation. So I think this is the one that's probably been bothering her more lately. L3-4. Any other questions, Henry?
No current questions.
All right. Well, I am really excited about those pictures, Henry. We have seen some really good granulation tissue lately, haven't we? And we've got it on film. You know, Henry, there was an old saying, film doesn't lie. But nowadays, unfortunately, with all this AI stuff going on, you know, there's so much fake pictures out there.
I'm going to have to disagree with you. Film does not lie with movies that came out way back then. I mean, like...
Huh? Movies what?
When movies came out back then, I mean, like, it was a story that wasn't true. So, in a way, it was a lie.
No, but film doesn't lie. What I mean is the film. The story may lie, but the film doesn't lie.
True.
I was always taught that the surgeon's card does not lie.
The what? Surgeon's what?
Card, your OR card does not lie.
Oh, I don't know. All I know is that in the old days, you could take a picture of something and it was believable, right? Now, Everybody manipulates
Okay, yeah,
pictures.
that's true. Yeah.
Like you have all these filters, for Snapchat, for example, that it's amazing. You have take a very average person and you can make them look like a supermodel. Anyway, it's not just that. Like I saw one the other day where some guy was like, or somebody posted a picture of literally a woman from like 1910, and she was on an electric scooter, and it had a handbrake, and it had everything that a modern electric scooter has. And they said, see, we had electric scooters back in 1910. I'm like, that's such bullshit. That is such a fake picture. Like I'm seeing a lot of these fake pictures now of like these giant fish and monsters and stuff, or humongous like 20-foot alligators. Of course, they never existed before AI. Now they exist. I guess what I'm saying is our pictures are real. We don't doctor them. We don't even surgeon them. But I guess the value of images now is decreased, unfortunately. Any more questions, Hen?
No current questions.
Well, you can see the blue dye. It's staining to the degenerated herniation. The degenerated herniation. Just about done, Doc. 5 minutes. 5 minutes. Yeah. All right. Yeah, we're almost done. You can see the scar tissue here. But basically, in summary, this patient has two herniated discs, but one of them is on both sides, so it's really a double herniation on a disc. And I gotta say that looking at everything here under high definition and using the laser on it, I gotta say it doesn't really look like anything different than what we normally see, with a herniated disc. You got the herniations right there, the blue stuff stuck in the annulus. You got inflammation. You got the golden coloration that the laser interacts with. That's calcium. And honestly, if you told me this is a patient without Ehlers-Danlos, or with, I wouldn't have been able to tell the difference. I would not be able, and I've done thousands and thousands of these surgeries. So if anybody can tell the difference, it's me, and I can't tell the difference because her disc herniations look the same as so many other people's. I think she's going to hopefully enjoy watching the surgery. Now, I will tell you, she's coming back on Thursday for her neck, and we're doing 4 levels on her neck. And she has me doing a disc that I almost never do. It's number C23. She's got a big C23 herniated disc, C34, C56, C67. So I personally don't like C23. It's very high in the neck, hard to get to. I've only had one other patient in my career that I've had to fix a C23 herniation. It's very rare that C23 herniates. It's very rare that C23 causes symptoms. But with her, I feel very confident that C23 is symptomatic and needs to be fixed. And you guys will see it on Thursday when she comes back and gets her neck done. Now for that surgery, she'll be completely asleep under general anesthesia. All right, any questions, Henry?
No current questions.
Wow. So we're just about finished. This is the end of the disc. Right here, we're starting to see what's called foraminal ligament right there. That means we're outside the disc now. We're just finished. And boy, I'm just cleaning up the last of the herniation right here. Once I get rid of this, all of that back pain she has from these discs will be gone. Now, she's still going to have back pain from her facet joints. We talked about that earlier. I haven't fixed her facets. We're going to have to ask her insurance if they'll cover it, because we sort of discovered it yesterday unexpectedly and when I examined her. And so if her insurance agrees, she'll be back getting her facets treated. By the way, she has, I want to say she has Christian Care Network, doesn't she? Some of our patients have Christian Care, and they get these surgeries covered through Christian Care. I get people asking me all the time, what insurance covers your laser surgeries? Christian Care Network does. So for those of you interested. All right, we are done. Look at that, how pretty that is. Let me see, I have a little bit right here actually. Any more questions? Because we're going to wrap this up.
No current questions.
All right, thanks for joining us. It's been a really good day. We've gotten a lot done. We've helped a lot of people. And we'll be back on Thursday for some more. You can't even see the nerve. There's the nerve right there, but it's in fat. So real nice, all done. Thank you, Dr. B. Nice work, everyone, today. Henry, you're welcome to end the broadcast whenever you want.
Copy that.